Hi gals, so today we're talking about who should freeze their eggs to retain their fertility and when you should do it and how it's done. So who should freeze their eggs? First of all, you should freeze your eggs as soon as you're considering freezing your eggs, because the longer you wait, the older your eggs will be. And adding age to your eggs makes them a little bit more fragile. So if you're in your 20s, that's probably the best time to freeze your eggs. If you're in your 30s, that's okay. If you're already in your 40s, it's probably not the best idea to freeze your eggs. It would be probably better to freeze an embryo when the sperm and the egg are combined already. So the process of freezing your eggs is, first of all, you have to go see an infertility OBGYN. So it's not just any GYN that does this procedure. It has to be someone who specializes in infertility. They're called REI doctors, reproductive endocrinology and infertility doctors. A lot of insurances cover part of the process. Most insurances don't, so mostly it'll be a cash procedure, and we'll talk about costs. But basically the way it's done, it's like a 4 to 6 week procedure where they give you some oral medication or oral hormones and injectable hormones that you would give yourself at home to reset your menstrual cycle, and that takes like a month or 4 weeks. And then for 2 weeks, you will give yourself injections of hormones to start to stimulate your eggs and prepare you for the doctor to go in there and harvest the eggs or take out the eggs. After you're ready to get your eggs harvested or taken out by the doctor, they take you to their office. It's usually a procedure that's done under sedation, we call it. They just give you some medication to calm you down. It's not under anesthesia. And they do vaginal ultrasound. So they put you in the stirrups on a bed like this, and they use a needle and they use the ultrasound to guide themselves to take out each egg. Usually in each one of these procedures, they will take out as many as they can. Most of the time it's somewhere between 10 and 20 eggs. So if they've taken out, for example, 10 eggs, there's 2 ways for them to freeze the eggs, and that it's not important for us to know. The infertility doctor will freeze the eggs, and then out of those 10, for example, approximately 7 of them survive the thawing, or when you're ready to unfreeze them, maybe like 7 of those will survive, and out of those maybe 5 or 6 will become embryos when you combine them with sperm. And then when you go and you put them in the body, maybe 3 or 4 of them, for someone who's 35 years old, they'll put in 3 or 4 eggs inside to see how many of them latch on. Usually you get one single pregnancy or twins. It's very common to have twins when you do these types of procedures. The eggs can be frozen for up to 10 years very safely. They'll survive well. So the cost of this is pretty much the same as having IVF or in vitro fertilization. So it's somewhere you can shop around, of course, until you get the doctor that you like and the price that you like, but it's usually around $8,000 per harvest, all the way up to $12,000. And usually they'll freeze them for the first year for free, and after that you'll have to pay somewhere between $500 to $800 a year after that. So if you freeze them for 10 years, that's another $8,000 or $5,000. All right, you guys, so make sure you like the video, subscribe to the channel, send me any questions to gynogal@gmail.com, and like us on Facebook. And if you'd like a consult, you can find me at care.it and just look up my name, and I'm happy to see you there. See you next week. First of all, I'd like to just state that it is a federally illegal drug. Even though it's been approved for medical use in certain states, it is still considered illegal in the whole country. So I don't encourage anyone's use.